And this video is on Menkes disease. Imagine being on your pediatric rotation and seeing a patient with hypotonia and growth retardation. What are some differentials that come to mind? Being the gunner you are, 4, 5, and 6 plus diseases come to your mind. Well, what if this patient has brittle, kinky hair? Ah yes, Menkes disease should quickly come to mind. We'll be going over Menkes disease, and by the end of this video, you should 1. Understand the cause of Menkes disease, 2. Describe clinical significance, and 3. Describe diagnosis and disease management. Menkes disease is an X-linked recessive connective tissue disease caused by a defective gene called ATP7A. It is extremely rare, only affecting roughly 2 or 3 people out of a million. The gene codes for an ATP-dependent copper transporter which is found in most tissues, including the small intestines where it helps absorb copper from the diet. So ultimately, you get impaired copper absorption and transport, as well as low copper levels. Can you think of any other disease that has a defect in the gene ATP7? Yep, that would be Wilson's disease, which has defective gene ATP7B. Very important to remember this minute difference. You can get a question where a patient is described to have a defective copper transporter and tells you the gene ATP7A is mutated. It can then ask you the mode of inheritance of this disease. ATP7A is Menkes disease and is an X-linked recessive disorder, while ATP7B is mutated in Wilson's disease, which is an autosomal recessive disorder. Additionally, copper levels are low in Menkes disease while they are high in Wilson's disease. In short, it's important to remember details that seem so minor. Okay, so back to Menkes disease. Can you recall what enzyme in collagen synthesis requires copper? I'll give you a hint. It's used to cross-link triple-collagen triple helixes together to make collagen fibrils. That would be lysooxidase. So deficiency in copper causes a defect in this enzyme, ultimately leading to a defect in cross-linking. This is how a defect in copper transporting protein and impaired copper absorption leads to collagen deficiency. Signs and symptoms will be noticeable shortly after birth. You can see seizures, hypotonia, as well as growth retardation and blue sclera, which is similar to what you'd see in osteogenesis imperfecta. Later you'll see intellectual disability and the most classically described brittle kinky hair, although I would describe it more of a kind of sparse and fuzzy looking hair. Now to diagnose this disease, you can do so a few different ways. If there's a family history of the disease, you can do a newborn screen, which is performed early on before any symptoms appear. This involves taking a blood sample and measuring certain neurochemicals that, depending on their levels, can allow for early detection. If there's no family history and the child begins to develop signs and symptoms, a genetic test can be done, and this will check for the mutated ATP7A gene. You can also microscopically examine a patient's hair and check for the characteristic twisting and splitting seen in Menkes. As far as treatment goes, you can actually treat this by injecting copper into the patient, although that only partially helps, though copper histidine injections have been shown to improve hair abnormalities. Since onset occurs during infancy, it's very important to diagnose and start treatment as soon as possible in order to prevent developmental problems. Okay, let's do a quick flash quiz. What gene is impaired in Menkes disease, and what is the inheritance pattern? Copper absorption and transport is impaired as Menkes disease due to a mutation in Menkes protein ATP7A. Again, not to be confused with Wilson's disease, which has a mutated ATP7B. Menkes disease has an X-linked recessive inheritance pattern. Okay, so the bottom line is, Menkes disease is caused by a mutation in ATP7A, leading to impaired copper absorption and transport, as well as low copper levels. Clinically, you may see seizures, hypotonia, growth retardation, blue sclera, and the classical kinky hair. The disease is typically diagnosed by genetic testing, but can be diagnosed by newborn screening test if there's a strong family history. Treatment is done with copper injections. Alright, that's all for Menkes disease. Thanks for watching. If you liked the video, don't forget to give a thumbs up.